hiding #coronavirus cases in New York? This voicemail message was left for Dr.
A doctor in New York.
Hi, I just want to leave a message for Dr. Paul Trell. And my wife works at one of the hospitals in Buffalo, New York, and I just wanted to let you know that we have a bunch of people here that have coronavirus, but they're not putting it on the New York State or the CDC website. There's a bunch of people that have tested negative and a bunch of people have tested positive for coronavirus in Buffalo, specifically Amherst, New York, and North Tonawanda, New York. But the news is not covering it here. And my wife and her co-workers are treating people and testing people for coronavirus at DeGraaf and Millard, Fillmore. I just thought you should know, and hopefully the word will be spread. Hi, I just want to leave a message for Dr. Paul.
Okay, so we're going to go over this situation whereby it seems as though the CDC is hiding the true numbers of COVID-19 in the state of New York. So I have a caller online, and we're going to go over in detail specifically what is going on. So, thank you for sharing this information, and go ahead and tell your story.
So I live in the suburbs around Buffalo, and it's a pretty small town. And there's a lot of small towns of like 10,000 or so, 20,000 around the outskirts of Buffalo. And there's a large college here at the University of Buffalo, and they have about 1,500 students from mainland China. This is according to their website. After the winter break happened, the winter break started like mid-December and ended, I think, January 7th. And ever since it ended, there has been like every few days there would be somebody that would come into the hospital and where my wife works, and she would say, hey, there's another person from Wuhan or another person from China with pneumonia. And this was before it was like a really major deal on the news. And it's just a steady trickle of people had been coming in, getting tested for coronavirus at the Kalidda healthcare systems. Kalidda Healthcare owns most of the hospitals.
Can you spell that?
In New York.
Can you spell that?
Kalidda, I believe, is spelled Kalidda. And that's the company that operates most of the hospitals here in Western New York. And that's where my family works. So ever since the UP semester started again, there's been people at the campus coming in, and there's also been a few people that I guess have crossed from Canada over to Buffalo, because we're right near the border. And there's been a steady trickle of people going into DeGraaf and going into Millard, Fillmore, Suburban, and people being tested both positive and negative for coronavirus for about the last month and a week.
Now, when you say coronavirus, you're talking about COVID-19, right?
Correct. I'm talking about COVID-19, the virus that originated in Wuhan, China. And I think the most alarming case that comes to my mind is on January 28th. This was a very major one, because all the other ones that people haven't been that sick, and the hospital's either been testing or not testing them. And even if they are tested positive, they release them. But this one was kind of different. On the 28th, a Chinese man in Tonawanda seemed to be very sick. He had trouble breathing, fever, pneumonia, coughing. So MS picked him up and bring him into my wife's work. And there was a lot of calls going around. My wife was present. They were calling the CDC. They were calling a bunch of people, because this was kind of the first case where it wasn't like the asymmetric or the very mild symptoms that you hear. Some people have mild and some people are very severe. So I think this was the first person with a severe case. So they were calling CDC they were calling all the higher-ups how to deal with this person. They originally went into the ER, and then there's one airborne room at DeGraaf, and they placed him in the airborne room eventually. My wife was there, they were calling everybody, and eventually Kalidda told all the healthcare workers that COVID-19 is airborne, and they need to start taking airborne precautions, because prior to this, they didn't have any precautions in place. Like, there's not even a poster in any of the hospitals at Kalidda. There's been no meetings, people haven't been wearing gloves, they haven't even been wearing surgical masks, testing or imaging these people.
So before you go any further, let's just clarify in terms here. When they say airborne, are they saying airborne because of droplets, or are they saying airborne?
No, they're talking about those very small particles that can linger in the air for more than 3 to 6 feet. They're talking about they can go across large rooms and large areas, not the droplet size.
Okay.
Kalidda has told the healthcare workers there that it is airborne and to treat it like tuberculosis. So on the 28th, when the man was admitted to DeGraaf, my family was there. They overheard the CDC calls. They overheard all the calls to management. The young woman who had to go into the room to image them was freaked out. She was panicking. Nobody at DeGraaf, 99% of the people at DeGraaf couldn't even tell you where the airborne room is. And the same at all the Kalidda hospitals. Each hospital has either no airborne rooms or one airborne room. And pretty much nobody there has used it. My wife's been working for Kalidda for about 15 years. She's never even used the airborne room. Nobody really has. So they were panicked. They had no idea what to go in there. They finally decided on hazmat and N95 and gloves. They did not start using goggles yet. My wife was saying you probably should be using goggles, but they weren't even advising for that yet. The Tonawanda Fire Department that arrived at the scene on the 28th actually made a Facebook post alerting the public that they picked up a man who had recently been to China in Tonawanda, and they made a Facebook post. The Facebook post actually was deleted the 29th, and there's a news article about it that Gail Bernstein told the Tonawanda Fire Department to delete the post alerting the public of a suspected coronavirus case. And I think this is the most public case that people can, with their own eyes, go and see.
But why did she delete the post? Why did she delete the post?
Gail Bernstein, who's the health commissioner for Erie County, which Buffalo is in, she forced the Tonawanda Fire Department to delete the post and place a gag order on healthcare workers and
But why did she do that?
her reasoning, I guess, was because it doesn't really make sense.
cases have gone through Kalidda and have been tested positive for COVID-19?
Just 6 that I know of, but how many others are there in Buffalo and Niagara Falls and Rochester? But I've read a few articles where there's about a dozen people placed in isolation in their homes suspected to have it. There was a prisoner in the Buffalo prison system that they released on Friday. They suspected to have it, a man named Kevin Q. And they didn't even test him. They just said they thought he had it and he was released. There's people in Watertown, New York that are in isolation about it, but they won't say the exact number, so it's unclear.
Are there any hospital staff that have been getting the COVID-19 and testing positive?
I'm not really sure, but I wouldn't be surprised because in the early weeks of January, people weren't even wearing masks or gloves when they were imaging or swab testing them. It's only recently, until the 28th, that airborne rules have been implemented in the hospital systems here.
All right.
So I wouldn't be surprised.
And all these 6 cases, they've been tested at the CDC or at the hospital?
They're doing swab tests at the hospital, and then they're sending the test results out to the CDC, and those test results are usually taking a few days. And meanwhile, while the test results are out, the people will already leave the ER.
And then those test results come back to the hospital, and then the hospital is notified that that individual has COVID-19. And then once they know that someone has COVID-19, do they contact those individuals? Or what exactly is once the hospital knows from the CDC that they have a COVID-19 patient, what happens?
Basically nothing. I'm not aware whether they contact them or not. That they do contact them, but I can tell you that the nurses and the doctors treating the people are not aware of the results. In the hospitals, they place boards in certain rooms, in the rooms or outside rooms, so that people are aware of, like what's going on, how to treat them, what kind of medicine they're on. Every time somebody has a confirmed case of this, they're deleting the board so that nobody in the hospital knows. They're trying to keep it hush.
All right, so wait, I'm a little confused here. Someone is sick. They go to the hospital. They get a swab, and there's also they get a swab. They have a test at the hospital and then at the CDC.
Yeah, so they.
Wait, hold on. Let me finish. I want to make sure that everyone that's listening to this understands very clearly, because everyone that's going to be listening is going to nitpick this to death. So I'm going to make it as simple as possible for stupid people. Okay. All right. So when someone's sick and they're going to the hospital, the hospital protocol during this time period was to do a swab, do a test on site, and then also have the CDC on a different site to do a test for COVID-19. So at the hospital, the hospital only probably could determine if it's coronavirus. They couldn't determine if it's COVID-19 because they didn't have a test kit yet.
Yeah, the hospitals themselves can't confirm it. They have to send the swab test out to the CDC.
Okay. All right. So they're treating the patient while they're waiting for CDC